Good day, everyone. My name is Catherine N. Paris. Thank you for listening to my biomedical ethics presentation. I will be presenting on the topic Refusal of Treatment. We will explore the ethical dilemmas in two landmark cases that have shaped our understanding of patients' autonomy, medical ethics, and end of life care. These cases are Karen Ann Quinlan from 1975 and Elizabeth Bovia from the 1980s. Let's dive into these cases and the ethical dilemmas they present. Our first case is Karen Ann Quinlan. In 1975, 21-year-old Karen overdosed and fell into a persistent vegetative state. She was kept alive on a ventilator, but her parents believed she would not want to live in such a condition and sought to have her life support removed. They argued that she should be allowed to die with grace and dignity. Now let's analyze the ethical principles at play in the Quinlan case, one by one. The key principles are autonomy, which gives patients the right to make decisions about their own health care. But in Karen's case, her wishes were unclear. So her parents acted as surrogate decision makers. Should their decision be respected? As for beneficence, it compels healthcare providers to act in the patient's best interests. Was it in Karen's best interest to continue life support, or was allowing her to die more compassionate? Non maleficence, which is the principle of do no harm, in this case was at stake. Would continuing life support cause harm by prolonging suffering, or would withdrawing it cause harm by leading her to death? Let's look at justice, a core principle emphasizing fair and impartial treatment, ensuring individuals receive what they are due, whether it is the distribution of resources or the application of punishment, and upholding the rights and well being of all. So, should medical resources be used to maintain a patient in a vegetable state, or should they be allocated to patients with a higher chance of recovery? Let's answer the ethical concerns with two possible solutions. One, withdraw life support, which allows her parents to make the decision. This aligns with autonomy and beneficence and avoids prolonging suffering. However, it raises concern about the slippery slope of euthanasia. The second possible solution is to continue life support indefinitely. This aligns with beneficence, preserving life, and non maleficence, avoiding active harm. However, it may conflict with the family's wishes and raise concern about resource allocation. So, therefore, the most reasonable solution would be to respect the parent's decision and provide palliative care, allowing her to pass away naturally, ensuring that she is comfortable and preventing unnecessary suffering. This aligns with the legal ruling and sets an important precedent for surrogate decision making. Our second case is Elizabeth Bouvia. Unlike Karen and Quinlan, Elizabeth was mentally competent. She was a 26-year-old woman born with cerebral palsy and severe degenerative arthritis, which caused her chronic pain and total dependence on caregivers. In 1983, she voluntarily admitted herself to a California hospital requesting palliative care while refusing food and hydration. She intended to die with dignity, but doctors deemed her suicidal and force fed her. Now let's look at the ethical principles involved. The first and most crucial ethical principle in this case is autonomy. Elizabeth was mentally competent and explicitly expressed her wish to refuse life sustaining treatment. The ethical concern was whether her autonomy should be respected even if her decision led to her death. The second principle, beneficence, it questions whether the medical team believed that force feeding and continuing treatment were in her best interest, as they aimed to preserve her life. However, Elizabeth argued that her quality of life was so poor that death were preferable. And for non-maleficent, the principles of do no harm, the ethical concern was that force feeding and continuing treatment against her will could be seen as causing harm, both physically and psychologically. On the other hand, allowing her to refuse treatment could be seen as causing harm by leading her to death. And for the last principle, justice, it raised questions about whether disabled individuals receive equitable treatment, or was Elizabeth's request influenced by social discrimination against people with disabilities, or was it genuine, or was it a genuine expression of her autonomy? For this case, I came up with two possible solutions. The first possible solution is to respect Bouvia's refusal of treatments. This solution aligns with the principle of autonomy, as Bouvia is mentally competent and has the right to make decisions about her own body. It also aligns with non-maleficence, as it avoids forcing treatment on her against her will. The second possible solution is to continue treatment against her will. This solution aligns with beneficence, as it aims to preserve her life, and non-maleficent, as it avoids causing her death. However, it conflicts with her autonomy and also challenges societal disabilities. But the most reasonable solution is to respect Elizabeth's autonomy and allow her to refuse treatment. This solution aligns with the principle of autonomy, as she is mentally competent and has the right to make decisions about her own body. It also aligns with non-maleficent, as it avoids forcing treatment on her against her will. While this decision may be controversial, it is ethically justifiable given her clear expression of her wishes. Now, let's discuss the broader ethical implications of these cases. Karen and Quinlan. This case set a legal precedent for the right to withdraw life sustaining treatment when patients' wishes are unclear. It also led to widespread adoption of advance directives and living wills, allowing individuals to specify their preferences for end of life care in advance. Elizabeth Bouvia. This case reinforced the right of mentally competent adults to refuse life sustaining treatment, even if it leads to death. It also sparked debate about disability bias and whether societal perspective of disability influenced Bovier's decision. Let's recap. Both the Karen and Quinlan and Elizabeth Bouvier cases highlight the complex interplay among ethical principles. Karen and Quinlan case, this case raised significant ethical concerns about autonomy. Who should decide when the patient cannot? Beneficence, what is the patient's best interest? Non-maleficent, is it harmful to continue or withdraw treatment? And justice, how should resources be allocated? As for Elizabeth Bouvier case, this case highlighted the tension between autonomy, Bouvier's right to refuse treatment, and beneficence, the doctor's duty to preserve life, while also raising questions about non-maleficent. Is force feeding harmful? And justice, a disabled individual treated equitable? The key takeaway is that respect for patient autonomy must be balanced with other ethical principles. Final thoughts. I leave you with a question. If you were faced with a life altering decision, how would you want your healthcare choices to be respected? Finally, here are some key sources. Once again, thank you for listening to my biomedical ethics presentation on refusal of treatment. I am happy to take any questions in class. My name is Catherine in Paris. Bye.